Listening Part B. You hear two doctors discussing a patient. Now, read the question.
Oh, Dr. Khan, have you got a moment? I wanted to talk to you about polypeptide.
Sure, Dr. Jones.
Polly is a 6-year-old girl with a medical history of asthma and eczema who was admitted yesterday for an asthma exacerbation. She presented with shortness of breath and cough after visiting her grandparents, who are smokers. She responded well to albuterol and prednisolone in the emergency department, but was admitted due to persistent hypoxia in room air. She was also given a recent dose of acetaminophen because of fever. Her current temperature is 39.7 degrees Celsius.
How is she on auscultation?
There are significant audible expiratory wheezes throughout the left lung and in the right upper regions. Her breathing sounds are diminished and there is an absence of wheezes towards the right base.
Possible bacterial pneumonia?
Dr. Jones, that's what I was thinking. I'm sending her for a full range of tests to confirm. Thank you, Dr. Khan.
Listening Part B. You hear a dietitian talking to a patient. Now, read the question.
There are reasons the doctor talked to you about being on a diet that's low in fat.
I know, but I like salami, cheese and chips. A meal's not a meal without bread and butter.
I can understand that it's hard for you. I myself have tried to eliminate nearly all the fat from my own diet, and it is difficult to give up the things we love so much.
What foods have you had to give up?
Well, ice cream was my favourite. I used to have a bowl of it almost every night. But there's been others, butter, sausages. Look, no one's saying that you can't eat fatty foods occasionally, but you really do need to try and reduce your overall fat intake if you want to start feeling better. Here, let's look at a possible meal plan. It'll give you a better idea of what I'm talking about.
Listening Part B. You hear a professor of emergency medicine giving a presentation to a group of trainee doctors. Now, read the question.
European wasps feed on meat and meat products, such as dog food and barbecue scraps. They also like to scavenge sweet food and drinks and steal honey from beehives. Their stings are not barbed like bee stings. This means a single wasp can sting repeatedly. The toxins in the sting will cause a powerful reaction, and in some people, an allergic reaction. Because they are attracted to food, many wasp stings are in or around the mouth. These are the most dangerous places for a sting, as swelling can result. Minor reactions include painful swellings on the lips, while in severe cases, there can be a blockage of the trachea due to swelling, and in the most severe cases, this can even lead to death.
Part B. You hear a GP talking to a regular patient who has been having kidney problems. Now, read the question.
Hello, Mr. Hartley. Come and sit down. I gather you've been having more trouble since I last saw you.
Yes, that's right. I kept vomiting and feeling dreadful. I can't keep on like this.
It looks as though the next step will be to get you to hospital to start further treatment. I think you're going to need peritoneal dialysis treatment.
What's that, Doctor?
It means putting a tube into the abdomen and then washing fluid in and out to keep the toxic substances in the blood down. It's not uncomfortable, and you'll be taught to do this yourself for when you get home. With this method of dialysis, you can walk about and live a reasonably normal life.
Well, will I have to use this for the rest of my life?
Well, we will also take a specimen of your blood and put you in the computer database for a kidney transplant. If a suitable kidney becomes available, you may be able to undergo a kidney transplant operation. So you see, there are several ways of helping you. We'll just have to see how you get on. Transplant. If a suitable kidney becomes available, you may be able to undergo a kidney transplant operation. So you see, there are several ways of helping you. We'll just have to see how you get on.
Listening Part B. You hear a physiotherapist in a hospital talking with John, a new patient. Now, read the question.
Okay, John, now that we've established you're not going to be playing sport, here's what you're going to need to do for the next 2 to 4 weeks.
Okay,
First of all, you're going to have to wear a neck brace. You can get one in the shop down the ground floor.
do I wear that at night, like when I'm sleeping?
Well, you can, but you don't have to.
Okay,
One thing that will help you with the pain is an ice pack for 10 to 20 minutes, followed by a nice warm shower.
okay. I'll still probably be working a bit. We don't have a shower there.
If you're at work, you can just use a warm cloth instead. Another really good thing to do is neck and back stretches. We can go through those now if you like.
Okay, great.
Listening Part B. You hear a specialist physician and a nurse discussing a patient's treatment. Now, read the question.
Nurse, hello. I'm wondering if you can help me. I've just been going over the charts for Mr. Chu in bed 34, and I'm wondering why I wasn't told that his blood pressure medications were being held over the past few days.
Hi, Dr. Griezmann. Right, I'm not sure. I didn't even know that had happened. Let me look into it and I'll get back to you.
Well, there's no need for that. I've been sitting here for 20 minutes looking at the blood pressures and medications that have been given to the patient, and it simply doesn't make any sense.
Well, I really don't know, Dr. Griezmann. I've literally taken care of this patient for 4 hours. I can discuss it with the nursing director, though, if you like.
No, that isn't necessary. Thank you, nurse.